If you've been told that you've got diastasis recti, or otherwise known as abdominal separation, what sorts of exercises should you do? Do you just need to blast those ab exercises to make that gap disappear and pull together? I'm Lisa from Optimum Health, and that's what I'm going to be talking to you about today with the help of my front door and curtains. So you may have seen my previous video on this where I explain the concept of that abdominal separation using the curtains to represent the top layer of abdominal muscles, your six-pack, and the front door behind to represent that connective tissue that those muscles connect onto, with my letterbox being your belly button. So potentially if we hit that diastasis or gap, metaphorically speaking, with loads of abdominal exercises like planks, sit-ups, mountain climbers, Russian twists, anything like that, then potentially we are putting more strain onto the way those muscles connect with the tissue down the centre. In fact, if we're using those oblique muscles which are underneath your six-pack too much, then potentially we could be drawing those curtains open more if we are not able to create appropriate tension down the centre. So you can see the effect on the curtains there of overdoing work through the abdominal muscles without the appropriate foundations to hold your resilience, your stability together for that particular movement. So that's why when it comes to abdominal separation, maybe it's not a separation by strict definition, but you have this weakness down your front. The first stage is to be able to create appropriate tension through this midline that runs from your chest bone through to straight down to the top of your pelvis, that all of those abdominal muscle layers connect onto. So you've got an effective bridge between the two halves of muscle, so that when you come to move and exercise, you're not pulling away from that midline. Now, it can be simple things like holding your child off on one hip that can cause that tension. So again, then strategies that work on your alignment, your breath with your lifting and appropriate lifting technique can all help you to manage your stability through your center, but your strength, and avoid pressure going either out into your abdomen or down into your pelvic floor. So this is at the heart of the coaching that I do on my Stronger Mummy program, coaching you to work from the inside out to really build those foundations to support your core and floor and build that resilience for long-term health, but also for dealing with your growing children as well. So if you have any questions on this at all, whether that's with regards to your own abdominal separation or core weakness in any way, then please do get in touch. It's important to get the right sort of help and support and approach for you, because continuing to work these muscles without that connection through the center can actually lead to the opposite of what you're looking for. So if you're looking to tone that abdominal region, maybe even flatten it, then drawing these tissues away from the center, as I've just discussed, could actually make that abdomen look more poochy or bulgy, but it can also increase your risk of pelvic floor disorders and persistent low backache as well. So to avoid those, it's important that we use the right strategies for you to allow you to connect through those tissues, to manage the pressure within your abdomen and move in a way that's appropriate for you every day. So if you've got any questions at all, or you would like my help and support, then please do get in touch. I would love to hear from you. Take care of you. Bye for now.